Welcome back to Up Front. Governor Evers and legislative Republicans are engaged in a back and forth over his public health emergency orders and the mask mandate. Assembly Republicans on Thursday repealed the governor's previous emergency order and the mask mandate that went along with it. Republicans keep saying it's not about masks, it's about orders they say are illegal. Well, within an hour, Governor Evers turned around and issued a new public health order and mask mandate. Health experts warned against repealing the mandate, saying masks are an essential tool to stop the spread of COVID-19. So we're talking now with Dr. Ajay Sethi, an infectious disease epidemiologist and associate professor of population health sciences at UW-Madison. We appreciate you being with us and your perspective today. Doctor, I want to ask you about the mask mandate in terms of what impact do you think a mask mandate has on a state?
I mean, mandates are important. There are a lot of ways we can try to get every Wisconsinite to wear a mask. And ultimately, that's what needs to be achieved. If everybody wore a mask outside their household when they're at risk for running into people who they don't live with, if everybody can do that, we really can make a serious dent in the spread of this coronavirus. So the question is, how do we achieve that to have near universal mask use? A mandate has to be part of that sort of toolbox.
Well, and one thing we really keep hearing about is these coronavirus variants, which sound to be more contagious. I'm wondering what you think about what could be going on here in Wisconsin. Do you think the presence of the variants is more than we even realize?
Probably. I mean, the variant from the UK has been detected in Wisconsin in one case. But as a state and really as an entire country, we're not doing nearly as much surveillance as we need to be to detect these new variants that are existing and circulating in our state. So when we do pick it up, we have to sort of humbly acknowledge that we probably haven't picked this up, for the very first time it was present in the state. That most likely there are other cases of that variant circulating.
What's your biggest concern when it comes to the variants?
Well, it's shown to be more infectious. So at some point, based on the experience of other countries, it will become the more dominant strain. And also that underlines the importance of mask use and all mitigation strategies, and also our vaccine rollout. We need to get people protected before this new variant sort of takes over the spread of COVID in the state.
And when it comes to the vaccine rollout, we hear so much back and forth from politicians. You're not a politician, you're a doctor. What is your medical opinion in terms of how we're doing when it comes to the vaccine rollout compared to other states?
Yeah, and I should clarify, I'm not a medical doctor. I have a PhD, so I can't see patients. And frankly, I'm afraid of blood, so I don't want to see patients.
You're still educated on this topic, though.
That's right. So regarding the rollout, yeah, I mean, Wisconsin as a state got sort of a slower start relative to other states. And some of the states that were quick out of the gate happened to also be some of the smaller states in the country where perhaps the logistics were easier to manage initially. We hear about West Virginia, for example, that is doing well relative to other states. But since that initial period, Wisconsin has actually had a good couple of weeks. And I would say we're sort of in the middle of the pack as far as the U.S. goes. And comparing our state with similarly sized states like Maryland, Colorado, Minnesota, we're actually doing quite well.
And we are seeing some lower COVID numbers here in Wisconsin. What does that say?
Yeah, the cases have been declining, and that's good news. And we need to continue with sort of the mitigation that led to this decline in order to get this down far enough so as this new variant sort of becomes more dominant, it doesn't have a chance to really spread if we're wearing masks and keeping distance and sort of minimizing our travel outside our homes.
I have heard, though, that health officials are concerned that not enough people are getting tested. What do you think about that?
Yeah, I mean, as a country, we've never really tested nearly as much as we should be. Often what happens is what prompts somebody to get a test is having symptoms. And so we know that there are a lot of asymptomatic cases out there that, aren't thinking about getting a test because they don't have symptoms. And they often are, the fuel of the continued spread in any community. And that's an issue.
Summerfest just announced that it's moving from June to September, and it has us all thinking about summer and what this could mean. Is it going to be a repeat of 2020? Will everything be canceled? I know you don't have a crystal ball, but what are you thinking we could be in for the summer?
Yeah, I mean, it is early to say. You could say that if everything goes really well, before the fall, we can start to see maybe fewer cases being transmitted. But the problem is these new variants that are more infectious. Hopefully the vaccines will remain effective against not just the new variants that have emerged, but also the potential for other new variants to emerge in the future.
How hopeful are you about this Johnson & Johnson vaccine?
What I like about the vaccine is that it's very effective in preventing hospitalizations and severe COVID at 85%. For preventing any symptoms, one dose will produce about 67% effectiveness, which isn't as high, but then you got to acknowledge that having symptoms but that don't require hospitalization is actually a very good thing. It being one dose is also very promising because there are lots of populations in the United States may be harder to reach, and so one dose to get that kind of effectiveness is really promising.
Dr. Sethi, thank you for your expertise.
Thank you so much.
Governor Evers vetoed AB 1, the Assembly's COVID-19 bill. The governor says the bill isn't a compromise. Democratic lawmakers also have introduced their own legislation to create a statewide mask order. Our editorial partner, WisPolitics, has all of these stories on the web at wispolitics.com as well as on Twitter. A couple of states award their electoral votes to the winners in congressional districts. We'll hear why some Wisconsin lawmakers say we should do the same. That's next on Upfront.